Hello everyone, welcome back to our channel. I'm Dr. Amel from City Skin Clinic, and today I wanted to have a little chat with you about CLENZIderm MD. This is an at-home skin treatment system that we offer, made by Obagi, and we offer this through our virtual skin clinic, and it's specifically designed to treating acne. So I wanted to talk a little bit about what this system does, who it's good for, and its limitations as well. Without kind of any delay, don't forget to subscribe to our channel if you like our content, and please give this video a thumbs up. And if you have any comments at all, just leave a message below, and if you have any questions as well, I'm more than happy to answer them. I'm going to leave some links below for some more information about acne and acne treatments, as well as our virtual skin clinic and the products and systems that I mention here. So I've mentioned acne before, and I've left a link to the video here, and I've talked a little bit about what causes acne and the underlying sort of pathology in terms of how the skin reacts, as well as the bacteria that cause it, and the complications with suffering from acne, including scarring and hyperpigmentation. And I will leave a link to these below. So with CLENZIderm MD, it's a skin system. It is a prescription skin products that you can use at home, and they contain 3 products. It's designed to be simple and as fuss-free as possible, so it's one of the reasons I really liked the idea of it, and they're designed to kind of get to the heart of what's causing the acne and treating that. There are 3 products, and there's a foaming cleanser which contains salicylic acid, and that's designed to clean pores. There is a lotion, pore therapy, and that also contains salicylic acid, and it's designed to exfoliate skin and stop clogging of the pores. And then there's the lotion, which contains benzoyl peroxide, and that the lotion is designed to get in deep into the pores and get into the skin, into the layers of the skin, to tackle the bacteria that cause the inflammation and so many of the signs of acne, the pimples, the redness. So these 3 products are designed to tackle acne and the inflammatory process in different ways, and they work really well together. The system is very, very bespoke, so how often when you use each product, how often you use it, that is part of the skincare routine that we develop for you, and then it progresses as your skin reacts and responds to these treatments. So some people may end up using the products more frequently initially and less so later, or the other way around, or a combination of this. It evolves with your skin and how it responds to it. And it's a really effective system. One of the things I like is that actually results can be seen in as little as 1 week of use. The other thing that we strongly encourage, and I often, unless there's a contraindication, is for people to use it alongside retinol, or preferably tretinoin if they meet the right indications. And again, we've made a video about tretinoin, so there's a link below about that. But the tretinoin or retinol will really help with a couple of things. One, it will help with skin texture, so anyone who suffers from acne will know that there can be scarring and that sort of thing. The other, they help, retinols and retinoids help with acne itself, and also with any post-inflammatory hyperpigmentation that occurs with the cycles of kind of pimples and eruptions that happens. So it's fantastic, and in my opinion necessary to add this, as long as there are no contraindications to retinoids. The one thing with this system, it's really effective, but with anything in life, the effectiveness depends on making sure it's used in the right person. So people that we wouldn't prescribe CLENZIderm MD obviously pregnant women, people who are planning to get pregnant or breastfeeding, people with any allergies to the products, and also certain types of really advanced acne where actually they are likely to need oral a treatment for the acne. So there are some incredibly severe cases where actually you don't want to waste that person's time or give them false hope, and this is why it's again really important to see someone who you have a really good rapport, to see a doctor that has a real interest in skincare and skin conditions and is able to direct you and be honest if they think this treatment isn't going to work for you. So the people where it can work for them, we really put everything into optimizing a skincare routine, getting you to use the system. With this system, we tend to say, it can be used for up to 24 weeks, but really it can be stopped earlier depending on how long, how your skin responds to it. And then in terms of maintenance, we go on to a skincare routine that kind of fits around your day. Luckily, this only had 3 products, so or a 4th if we're including tretinoin or retinol. And so the skincare routine you step down to may include something like 3 to 4 products, or fewer if you're someone who really couldn't manage doing 3 to 4 products. Again, with acne and anyone who suffered from acne and its sequelae, it's a problem that a lot of people will have suffered for a long time with it, and it's about finding a system that works, putting in the legwork, even in the cases of people with incredibly severe acne where I would say, honestly, this isn't going to work for you and you need to go and see a dermatologist and perhaps discuss having oral medication or other therapies. Even in those cases where people persevere and it takes a long time, you can really effectively treat your acne. It's about patience and about finding the right kind of treatments for you, and then taking care of your skin after you've put in all of that hard work. And taking care of it means, staying, if you can, on a retinol or tretinoin. It means protecting your skin from sun damage, and it means kind of any lifestyle modifications you've made that kind of keep you and your skin healthy as well. So I hope that's kind of given you a little bit of a background on CLENZIderm MD. Like I said, it's a great system, particularly for mild to moderate, and kind of moderate to slightly severe acne. For really bad cases of acne, you may need something else, and that's why it's really important to discuss these options in detail. Again, if you have any comments or questions, just leave a comment below. Please don't forget to like this video and subscribe to our channel and ring the notification bell, and see you again.